Good afternoon, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. Thank you for taking your time today to join us. If you are in New Jersey, it's a beautiful sunny day, finally, which we're enjoying. We are grateful that you could make some time to join us, whether you're watching us live or watching us on a replay. This is a very important conversation and almost a continuation of a conversation that we started last week with Commissioner Ortiz. We are continuing to share the importance around getting the COVID-19 vaccinations and talking about the various factors that are preventing certain sects of our population from accessing the vaccine. We know from the statistics that we're already seeing coming out from our vaccinated populations that our lower income individuals, our BIPOC communities, and residents in rural areas are being vaccinated at a lower rate than other groups. And that obviously is an issue. I'm so grateful to have two doctors with us today who are committed to addressing the health disparities for these communities and to share facts around the vaccine. So I'd like to start by introducing them both to you. We have Dr. Ena Marsan. She is an obstetrician and gynecologist, originally from Bergen County, and has an undergraduate degree from the University of Virginia. She continued her education at Rutgers University School of Public Health, where she received a Master's of Public Health degree. She graduated from the New York College of Osteopathic Medicine in Long Island, New York. After completing her internship at St. Joseph's Hospital in Philadelphia, she graduated from obstetrics and gynecology residency training at Nassau University Medical Center in East Meadow, New York. Over the past 15 plus years, Dr. Marsan has been an attending physician working in a federally qualified health center where she works with women of all ages, providing them with the care that they need at different times throughout their lives. She now has transitioned. Oh, she was there. I'm sorry. Now she's currently transitioned into private practice in New York City, and she's currently an attending physician performing office gynecology and office procedures. Next, and also thank you and welcome, is Dr. Luis Alzate-Duque. He was born in Bogota, Colombia, and immigrated to North Bergen, New Jersey at the age of 12. Growing up, he observed family members, neighbors, and friends who were interacting with healthcare system from a perspective of illness with little emphasis on preventative care. This, among other experiences, awakened him to the desire to pursue medicine as a career path. He received his medical degree from Rutgers, New Jersey Medical School in 2014 and completed his residency training in combined internal medicine and pediatric medicine at Rutgers, New Jersey Medical School in 2018. And he received an academic medicine fellowship through the Hispanic Center of Excellence at Rutgers, New Jersey Medical School in 2019. Currently, he is the professor of medicine and pediatrics at Rutgers, New Jersey Medical School, where he provides primary care services to adults and children in a Newark-based federally qualified health center. And I'm grateful to both of you. I know how busy you are, not only in your work, but in your advocacy around this issue. So we're so grateful that you could both take some time to be with us here. So with that, let's start with Dr. Marsan. Let's jump right in. I know as an OBGYN, you serve women of all ages and backgrounds.
Correct.
Is it through your practice that you are sharing COVID vaccine information to those you serve?
Well, definitely through my practice. In addition, I have quite a few colleagues that have definitely rallied around the thought process and just the general ideation that unfortunately our brothers and sisters that are African American as well as Hispanic or Latinx are not getting vaccinated at the same rates as our other Caucasian counterparts. And that most certainly is alarming. So I've just, coupled with quite a few of my friends and colleagues, including Dr. Duque, in terms of just trying to get more and more information out there to hopefully make people more comfortable to make an educated decision.
Well, it's wonderful that you've both been very focused on doing that advocacy work. I read in your bio that growing up you noticed that I'm sorry. One more question, actually, before I jump into that. It seems to come up frequently that if a person tested positive for COVID-19 in the past,
right.
That people may think that they don't need to be vaccinated or that they're immune to it. It seems to come up a lot for people. Can you talk to that point for our viewers in case they are, living with that thought?
Sure. So it's understandable that people feel as if, hey, I've had COVID, I made it through, I'm fine, and I have antibodies. And there is a certain amount of natural immunity that one would have after experiencing COVID-19 and recuperating. But what we've found through research-based evidence is that having a COVID-19 vaccine is going to elicit an immune response that is going to last a bit longer and be a stronger immune response for your body, because there's always a possibility, even after going through COVID-19 and with your natural immunity, that you could become reinfected. It's rare, it's a low risk, but it's still a risk. And when we're speaking of a disease that has such serious and life-threatening consequences, ultimately, always a possibility of death, you really have to take that into account.
And so and a follow-up question on that just coming to my mind in case one of our viewers are thinking about it. If you do have antibodies, right, and you do, even if you get the vaccine, I mean, I know vaccines are something that we, many of us get annually for different, we get them people get the flu shot or other types of vaccines. So even with them, it's something that you do have to do again, right? It's not always like one and done.
Right. Well,
thinking.
Right now, the CDC is not sure how long, the current vaccination is going to last. It is an ongoing process with a lot of reevaluation as we're kind of going through this. All of this is real time because we are really losing quite a few people in terms of death and even confirmed cases and the lifetime sequelae. There's a whole section of people that have made it through COVID-19 and are now considered long haulers. They're having long-term effects from having this disease.
Right. Thank you for clarifying that point as well. So, Dr. Duque, I know we mentioned in your bio that growing up you noticed that a lot of your family and your community weren't really getting preventative care. They were just more, heading to the doctor when they were really, really ill and needed to do that. Can you talk a little bit about why that's a common thread in so many underserved communities? Just got to get you off mute there. Okay.
There we go. Yeah. Thank you so much for having me here. I'm very excited to be here and share some of the knowledge. In terms of why our communities sort of focus on accessing healthcare from a lens of illness, I think it all stems from multiple sort of like social factors that affect health. Things like historically Black and Brown communities, have to work and sustain themselves, and it's in the line of work that we have. It's difficult to take time off or find time off, or right. We are living paycheck to paycheck. Not all of us, but certainly a good number of us. In terms of access to health, we may even lack insurance in some cases. So I think there's not like one instance or one reason, but I think it's a combination of different factors. Having role models or knowing, someone that you trust that you can access and have a good relationship with, because historically we're not represented in the healthcare system. So I think, it's many different reasons that really just amount to that, the fact that we access healthcare from an illness standpoint, but we're hoping that, with all the work that we do in community engagement, that, the message comes across and we develop that relationship.
Right. And, this is an opportunity, like this conversation today, to hopefully make a shift for some people, and have them think about, reaching out and gaining access to the vaccine. And for those of you watching today, just so you know, in the comments right now, we have shared with you some links that would be helpful for you to be able to get some information, more information about the vaccine, as well as where you can get the vaccine if you haven't gotten one yet and you're ready. Can you talk a little bit to the fact, I know that, there's been so much conversation coming out now as the school year is ending and then getting ready for the upcoming school year about children and if it's safe for them to give vaccines. I know we just started giving it to teenagers, Sure. In the last week or so, and there was suddenly a new rush. I mean, I have 8-year-old twins, so, I have even younger ones, but, we're all, worrying because even if the adults are vaccinated, right, a lot of the kids are not. And, we're fearful for their safety in the midst of all this.
Absolutely. And, it's very exciting right now. So Pfizer was just approved for individuals 12 years old and older. And that in itself is all driven by data and information and research that has proven the safety and the efficacy, or how well the vaccine works. And I think that's the bottom line. We have established that the vaccine protects to a very high degree for severe complications, and for the most part, it prevents transmission. There are these rare circumstances or rare cases where you may actually be infected with COVID, even if you're fully vaccinated, but it prevents the severe consequences. Mm-hmm. So there's right now research ongoing. Pfizer is doing a phase 1, 2, and 3 simultaneous trial, which is essentially looking at the safety, the efficacy, or how well the vaccine works, and unintended consequences in kids 6-month-old to 11 years old. We'll have, it's ongoing. We'll have the data. I think it just started in March 2021. So, it'll be a little bit of time for that to happen. But I think to your point, the importance of the vaccine is, although we know that the majority of children do not have severe consequences from COVID, there are high-risk individuals, right? We know what the high-risk sort of conditions are, things like diabetes, obesity, asthma, all these conditions, which have been growing in the adolescent and children population. And we have seen that there's a shift of demographics, right? Like when the pandemic started, we saw it was really older individuals. As we've gotten very good at vaccination, close to 300 million doses given and safety proven, we have seen a shift in the age demographic. So now we see the younger individuals have a really high number of COVID cases, right? So that will start coming down towards younger individuals. And if we want to get to any sort of normal, where we want normal activities, going back to school and, feeling safe and opening schools and seeing family and having gatherings, vaccination is really, what's going to get us there.
Absolutely. And there's been so much, and for either of you, if you can just speak to, there's been so much in the press about, the various vaccines and whether is the J&J vaccine safe. Should we be thinking about getting the double dose? Is the 1 dose safe? It was pulled and frozen for a while and then put back on. Right. And, as if there wasn't enough concern, obviously that heightened even more fear in anyone who already had some festering. Anything you can share on that front to help quell anyone's anxiety that might be related to that issue?
Sure, I can. I can add a little bit to that. Johnson & Johnson vaccine, or the Janssen vaccine, definitely is safe and effective. It received its emergency utilization authorization in mid to late February, and then they had the pause that everyone's speaking of starting around April 12th until the 23rd. And during that time frame, the CDC and the FDA reviewed the data that they had received at that point in time to try and determine, was this a good vaccine to continue using amongst this population, meaning the US population. So through that review, they found that they had given almost close to 8 million doses at that point. So by April 23rd, there were 8 million doses of J&J that had been dispensed or administered to various people in the country. And they found that, or what was concerning, was that there were 17 cases that were found to have a condition called thrombocytopenia syndrome, meaning there were large clots that were forming within blood vessels, and that could be most certainly life-threatening, especially when you couple that with something called thrombocytopenia, which means you have low platelets, and that can increase your risk for bleeding. So all of that mumbo jumbo basically means that it was a life-threatening condition that most certainly could cause death if not treated rapidly and appropriately. So once they looked at all of the data, if you look at 8 million people, 8 million doses that were administered, and you essentially had 17 cases that had a rare and adverse event associated with it, the CDC and the FDA recognized at the end of the pause that most certainly the benefits outweigh the risks, at least for our population, and then the pause was lifted. So is it safe? Yes. I always throw in the caveat, and also the emergency utilization and authorization now has an additional little caveat to it that states that for women between the ages of 18 and 49, perhaps they need to be aware that this rare clotting syndrome is a possibility, a low risk possibility, but that was what was found when they reviewed the data. So going forward, what does this mean? If you happen to be female and between the ages of 18 and 49 and you are uncomfortable getting Johnson & Johnson vaccine, it's understandable, even though it is a low risk for that type of rare abnormality to occur, but you still have two different vaccines, meaning Moderna or Pfizer, to choose from. So you can still most certainly be vaccinated, but that was what the concern was in terms of why was there a pause for Johnson & Johnson.
That's very helpful. Thank you for sharing it. And in terms of children, is there any issue or thought that a parent should have about the J&J shot or the Moderna or Pfizer? Is there any thought there that a parent should be considering?
So right now, the only approved vaccine is Pfizer vaccine, 12 and above. So that would be the only one that's available right now. There are ongoing studies, and we're just waiting to see what the data is. But just to echo Dr. Marsan's point of the safety of the vaccine, one of the things that they also pointed out was this concern about blood clots in the brain, and that was sort of one of the things that they wanted to really look at very closely. And they saw that it was 6 women and 6 million doses given of J&J vaccine. And when you look at this very rare disease of clot in the brain, it's a very specific type of clot in the brain, and you look at what is the rate in the general population, right? Like how often does this happen in the general population outside of vaccines? It was very similar rates, right? So it's not to say that this was an extreme high risk. If you had this vaccine, it was almost close to what happens in the general population without the vaccine. So I think that's a point to highlight, and it speaks to the safety of the vaccines. And in terms of, vaccine, we have to weigh the risk and the benefit. And I think that in terms of the risk of getting COVID and severe COVID and the complications, right? We're seeing obviously the likelihood of fatality in COVID, and then beyond that, the long haulers, right? They call them, where we have still sustained symptoms through a long period of time. So natural immunity, when the vaccine was first made available, I was the first one in line. I was like, I want to have it. I want to get it. I trust it. So I did have it. What I had was pain in my arm. And for the second dose, I had body aches and a little bit of chills, and I felt very tired. And after 8 hours, it went away, and I was back to normal.
Yeah, I think that was very comforting to see so many of all of you physician leaders be the first ones to step in line and get the shots, because that, definitely sent a message to those of us who were anxious about it. So I'm grateful that you've all been able to model that, behavior for us and get it out there. I appreciate you both shared so much information and so much detail for us. Before I wrap us up and ask you to each, if you have anything, in closing that you would like to share, specifically any, direct message to those who haven't taken the vaccine as of yet, and within, any of these, specific communities that we're, mentioning, that there, is less access and, less of rate of vaccination at this point. I just wonder too, I know that there's been so much conversation about variants. And what that means in terms of the vaccination. And I know I've heard many people say, well, it doesn't even cover everything, so why bother doing it? Could one or both of you speak to why bother, even though there may be other variants out there?
So I can go ahead, or Dr. Marsan, do you want to go first?
No, go ahead.
I'll pick it up. I was just going to say, the vaccines, specifically Pfizer, has been shown to be 6 months after up to 91% effective in protecting the transmission. And beyond that, like I said, even if you do get COVID in the very rare case, it stems the severe consequences of COVID. I would not want to take the chance, right, and say, I'm not going to get the vaccine just because there are variants, based on the fact that it has been shown to be so safe and effective. And then there's a thing called community immunity. So the more that we get the vaccines, the higher number that we get the vaccines, despite of variants, if we all sort of achieve that protection, and that generally they say it's something about like 70 to 80% of the people vaccinated, it creates sort of like a bubble that can protect even those that are highest risk and cannot take the vaccine. So it's not just for us, but for others as well who may not be able to have the choice to take the vaccine.
True.
Thank you. Thank you for explaining that. And, for our viewers, it's so important. I'm glad that you were able to hear this conversation, but it's so important that you share this information. That's why YWTV exists. It's an opportunity for us to be able to get information out wide and far through networks. Please, I encourage you to share some of what you heard today, integrate it into a conversation you have with a friend or a family member. Take the link to this broadcast and copy it. Send it in a text to someone to watch it, put it to your Facebook page, send it in Messenger. We really are looking for our community to help amplify these important conversations. You can help save a life by getting this key and important information out to your community and to your network, and helping us get it far and wide. And with that, any last comments either of you would like to make to those listening that might still have some hesitancy to try to bring them aboard?
I just like to say that we're here just to give information. It's not necessarily to push anyone in any one direction. Oh, you should definitely get vaccinated. But what you definitely have to do is armor yourself with enough information to make a decision, because you not making a decision ultimately still makes a decision for you. COVID is most certainly alive and well. It is still here. I was looking at the data and the statistics for the state of New Jersey, and we still have 1,011,000 confirmed cases with almost 30,000 people that have died. You have to at least educate yourself so that you understand what can happen by taking the vaccine and what's the potential in terms of your own health should you not, and even the health of your family.
Thank you, Dr. Marsan. Any other thoughts on your end, Dr. Alzate-Duque?
What I would say is, I think we obviously have to acknowledge the trust, right, that it takes for our brown and Black communities to take this vaccine. And I want to echo Dr. Marsan's point to arm yourself with information, right? And I think the good sources to go to would be your doctor, or the CDC, or the New Jersey Department of Health, or obviously go to organizations like YWCA, and get that accurate information. There's a lot of misinformation that is spread, Google, Facebook, and these are really not validated venues of information. It's passed down from one person to the next, and we don't know. It's sort of like a broken telephone, right? Like, what is accurate, what's not. The one thing I want to say is, I want to acknowledge the fact that there's so many barriers to the vaccine: transportation barriers, access, language, technology, getting off from work. There are walk-in vaccination mega sites in New Jersey. Go to the link that was shared. There is information there. Speak to a loved one that may be a little bit more tech savvy, that can navigate that system. There is Lyft services for free that can take you to the vaccination site, bring you back. So I would say, I want to empower you with information that's accurate and solid and health related and proven by the data. Maybe muted.
She's muted.
Thank you. Well, always somebody, right? Right. But I just wanted to echo and let you know, we'll put that information in the comments as well. Until early July, Lyft and Uber are providing free transportation, as the doctor shared, to be able to go get the vaccine if transportation is a barrier. And also, when we were talking earlier, we were talking about how it is free. There is no charge, and there's no need to have insurance or any kind of money or to pay for it. When you go, there is no charge and it's free. And the information that's collected is all confidential. I know many people are worried about their immigration status and, how that might get impacted by providing any information. Any comments you want to make about that too, right before we wrap up? Because I know that that's something that sometimes is a fear, and understandably.
I can, if you want, I can just share it in Spanish. Para toda la comunidad latina o habla hispana, solo les quiero pasar el mensaje que hay la información que se toma en los lugares donde se da la vacuna es totalmente confidencial. No sé, el estado de New Jersey ha puesto pólizas que la información no se va a compartir con organizaciones federales para personas que el estatus migratorio es una barrera. La vacuna es gratis, no hay necesidad de tener seguro, y le recomiendo que si no tiene una contraindicación a la vacuna, que se informe y decida si la va a tomar.
Thank you, Doctor. And again, for those of you watching and maybe seeing some of the comments about the Yankee players that tested positive, I think the doctors addressed why it's important that even with the vaccine, that there is the potential that, someone could still get it, but the issue is really that their reaction is very different once they have the vaccine than if they did not. So
we have seen that those 8 players have no symptoms. Right. And it's 8 out of 275 million doses that have been given.
Right. So I just want to point out that although I appreciate the comment, I think that you both really addressed that issue about why, it's important to get it, that it does really change your reaction and the symptoms that you would have once you have the vaccine. So once again, I want to thank you both so much for your time. I want to, again, encourage our viewers to think about the information that was shared, talk it over if you're still feeling hesitant with your doctors, with your loved ones, and make a good informed decision for yourself about how to proceed. We do encourage everyone to continue to join us. We have more interesting and inspiring and educational conversations on YWTV this week. Tomorrow we have our Share the Mic Now platform, which is where we take this venue and allow Black women in our community to share their stories. And we'll be talking with Teresa Johnson, who's the Executive Director of Never Alone Again, and talk about the important work that she's doing here in our community for survivors of gender violence. And with that, I also want to invite everyone to join us tomorrow, which is May 20th from 3 to 4 p.m. We will be hosting, along with Hollaback, a bystander intervention training to help give us strategies to stand up against street harassment. Very often we, are saying how we want to be part of the solution and not part of the problem when it comes to racism in our community, as well as when it comes to gender violence that we see. Having clear strategies to safely intervene is really important to be able to be part of that. And so with that, we hope you join us. We'll have the link here for you in the comments. It is free. It's 1 hour from 3 p.m. to 4 p.m. And you'll leave the training with clear, adaptable, and expert-approved set of tools to help you successfully and safely intervene and be a bystander intervention support. And so with that, we wish everyone a safe and wonderful evening. And thank you again so much to our doctors for sharing so much great information with us to help us navigate so much that's been coming at us, but so much that's so important. Thank you all.
Thank you. Thanks
for having us. Thank you.